So you see the thyroid lying in front of the trachea, and this is the esophagus. So trachea, esophagus is posterior to the trachea. So obviously this is the trachea, and the esophagus is just behind it. Usually the esophagus is collapsed. Trachea is open because of the cartilaginous veins. So because the esophagus opens usually when you have a food particle going or passing through it, unless it's a disease process as scleroderma where you have dilatation of esophagus. Okay, so the suprahyoid space has, I've just marked it in different colors, the spaces that are there, because different disease processes affect different disease spaces. Like this is the carotid space where you have the carotid artery and the jugular artery and the nerve, and this is the pharyngeal space, the parapharyngeal space, the masticator space with the masseter muscle, the parotid space where you have the parotid gland, the perivertebral space around the vertebral body, the prevertebral space that I showed you on the X-ray, the soft tissue in front of the vertebra. So these are different, and the retropharyngeal spaces. So different spaces for different structures. Usually in the carotid and these areas you look for lymph node enlargement with the vessels. Now if you go below in the infrahyoid region, again the same spaces, you can see posterior cervical space, again known for the lymph node enlargement. In children usually you have lymph node enlargement, which is the posterior cervical space. Again the carotid space, the prevertebral just in front, and the retropharyngeal space. Okay, now for the sinuses, like we do CT scan, I told you the occipital-mental view, we also do a sort of CT scan evaluation for the sinuses, but we need to have sort of every time the same landmarks for comparison. So we start from the posterior part of the sphenoid and we go anteriorly. So we make the patient prone and then we scan from perpendicular to this. So obviously the scanning is perpendicular like this. The cuts are like this. You cut the sinuses vertically like this. So 3 to 5 millimeter sections from the posterior wall of the sphenoid to the frontal sinus. So actually what you are doing is you are covering this part only. So you don't want to radiate the rest of the brain or rest of the structures. All we are interested in is this part. So we just focus on this part. So this is the sphenoid sinus that you saw on the lateral X-ray, but obviously on CT you have a better view of this. These are the clinoid processes. Sphenoid again with the septa in between. Now you start seeing the maxillary sinuses, and these are the ethmoid sinuses. Yes?
You're going from posterior to anterior?
Yes, we are coming from posterior to anterior because posteriorly is the sphenoid sinus and the maxillary sinus is obviously anterior. In between you have these ethmoid sinuses. What are these structures?
Concha.
Turbinates, excellent. You have these inferior turbinates and the middle turbinates. Okay? And this is the nasal septum in between. These are again the orbits. You can see the optic nerve and the recti, superior, middle, and lateral and inferior recti muscles. Clear on this? So we are just going more anteriorly. And here you stop seeing the maxillary sinus. And still you have, but now you have the frontal sinuses which are seen. Obviously they are in the frontal bone, just lying inside the frontal bone. So you see these frontal sinuses now. So all the 4 sinuses, sphenoid, ethmoid, maxillary and frontal sinuses can be easily picked up or seen on a plain CT of the paranasal sinuses. A little bit more in detail about the maxillary sinus, since it's the largest sinus. The problem with this sinus is its drainage pathway.
Yes.
The sinus is lying below in the maxilla, but the drainage is slightly up. So in an upright position, the sinus does not drain itself. So it has to be in the lying position or a few other maneuvers that help in drainage of the sinus. Obviously, if you have secretions inside, they have these cilia inside and they push the secretions through this pathway, which is the ostium of the maxillary sinus.
So put lying backward, just setting your head backwards.
Yeah, usually it's in the upright position, the drainage is not, it's not sort of gravitational, you understand? It's one of those sinuses which has its drainage in a weird position. So in an upright head, you will not be able to drain this sinus. That is why this gets infected commonly. So we are more concerned about this maxillary sinus. Okay. So this is the opening of the maxillary sinus, and usually it's a sort of little complex opening because it can have ostium, which is the maxillary ostium. It can have an accessory ostium, and it can open into a semilunar valve. Semilunar valve means a half moon-like opening in the nasal cavity laterally. But all this means that all these three openings actually open into the osteometal complex. We call this as an osteometal complex. So if you have disease process or any obstruction in this part, obviously you would have the sinusitis developing in the maxillary sinus. Here you see it is normally pneumatized. This means it is full of air and this sinus opening is open. One thing to remember, the structures that are adjacent to it can also sometimes narrow this opening. So, you know, the ENT surgeons are very much concerned about this opening. They want to know as much detail before they put an endoscope. These days they don't do an open surgery, they do a FES, functional endoscopic sinus surgery. So they just go through an endoscope. So they want to know the anatomy of this area before they put an endoscope. Understand? That is why the sinuses are now, the CT especially, has gained a lot of popularity among the ENT surgeons. Even the ENT surgeons themselves know how to read this area because once they go in, they know where to put the scope inside. They don't want to damage the structures that are adjacent to it. So this structure is called as the uncinate process. It lies just superior and lateral to this opening. Okay? This all structure is the osteometal complex. If you just want to say osteometal complex, it means this opening of the maxillary sinus. But in fact, the maxillary sinus drains into, you remember there are three meatuses, superior, middle and inferior meatus. Do you remember your anatomy?
Yeah.
Superior, middle and inferior meatus. So the maxillary sinus, the frontal sinus and the anterior ethmoids drain into the middle meatus. Okay.
But doctor,
so this one is actually draining into the middle meatus.
Doctor, you were mentioning that it's either open in the semilunar hiatus or it's
actually this osteometal complex is a sort of anatomically difficult area.
Yeah.
But in some, the maxillary ostium opens into this complex, or the maxillary sinus may open through the infundibulum into the hiatus semilunaris, or you can also have a accessory ostium. So it makes life difficult for you. That is why I am saying this area is very complex, and the ENT surgeons want to know where the openings are before they put an endoscope. Okay? For you, at your stage, just remember the maxillary sinus, the frontal sinuses, and the anterior ethmoid sinuses drain into the middle meatus. That's it. I don't want to confuse you more. But this was just to tell you that it's not that easy. Okay, so this is how the drainage pathway through the cilia, the secretions or the mucus inside is drained through this pathway and it goes into the middle meatus. Okay, this uncinate process is this part that I have marked. Okay, now there is another structure which is the lacrimal duct. You know what is the lacrimal duct?
Yes. Nasal
So
lacrimal.
the tear films are sort of kept there. There is a sac. This is the lacrimal duct. This is the sac-like structures. It also drains into the nasal cavity. You know where it drains?
Inferior meatus.
Inferior meatus. So this is the lacrimal apparatus, and the lacrimal duct obviously it drains into the inferior meatus. So this is the only structure that drains into the inferior meatus. What are the remaining structures now? Sphenoid, yes. Sphenoid drains into the sphenoethmoidal recess. Okay, and what about the posterior ethmoid? Superior. Excellent. So you know your anatomy. You don't know. So read this.
Dr. Atif.
Okay, I'll revise it for you. Don't worry. You don't know, I'll tell you again. Okay, the ethmoid sinuses, the anterior, middle. Some say there are also middle, but remember the anterior, you can divide them into anterior and posterior. So the anterior drain into the middle meatus. The posterior drain into the superior meatus. Okay, so there is another structure just above the ethmoids on either side. This is known as the cribriform plate. You know what is the cribriform plate?
Yes.
Yeah, it's just above
It
the
has,
ethmoid sinuses,
opening.
and it's separating the ethmoid sinuses from the brain.
Yeah.
So it's a very thin sort of plate, or you can say bone tissue between the brain and frontal lobes and the ethmoid sinus. So obviously the disease process can spread through this into the brain and can result in meningitis. But the reason for showing you this is there's another entity which is known as CSF rhinorrhea. Do you know this?
Yes.
What is this?
And there is a fracture.
So there is leakage of CSF into the nose. So these people have CNS pouring inside the nasal cavity. So the problem here is this part. So this bony cribriform plate or the septa which are there above the ethmoid sinuses, they are deficient or there is some fracture. Maybe these people have trauma and this can be fractured. Because this bone is very soft bone. The cribriform plate is obviously a very thin sort of bone and can easily get fractured. So the CSF sort of leaks into the nasal cavity through fractures of this part or deficient bone in this part. This is just to show you how it looks like. Now if you look at this part, there is a fracture here. You see? There is a fracture here. So the CSF starts pouring into the nasal cavity. Okay. There is another fracture here. You see, sometimes it's so small. Obviously you need a CT scan with thin cuts of the area to focus on these small bony defects in the cribriform plate. Okay?
Doctor, which measures? The CSF goes to which?
It's through the cribriform plate. The ethmoid cells. Just above the ethmoid air cells, there is a bone which separates the ethmoid cells from the brain tissue. So it's deficient cribriform plate. Okay, the sphenoid sinus drains into the sphenoid ethmoid recess superior to the superior concha. The concha are the structures which sort of divide the upper, middle and lower part, the nasal cavity. Okay, for the one who asked repetition, the inferior meatus drains into, so this is the only structure which is separate from the others. The nasolacrimal ducts is the lowest mode draining part and it drains into the inferior meatus. Okay, full stop. Middle meatus has maxillary, frontal and anterior ethmoid cells. The superior meatus has only the posterior ethmoid sinuses. The sphenoethmoid recess has the sphenoid sinuses. So this is all you need to remember. Okay? Clear on this? Anyone has any questions now? Okay. So this is again water view or occipital mental view, where you have this sinuses seen, or the bones are obviously displaced in this case. The petrous bones are here. So what do you see here?
Maxillary air sound.
So always when you have two structures like the orbits and the maxillary sinuses, try to compare them.
There's fluid.
So this one has air, but this one has a fluid level. So the fluid level, air fluid level can be in acute sinusitis, or if it's a trauma case, then you can also have hemorrhage inside. Then you need to see whether there is any fracture involving the maxillary bone, the walls of the maxilla. Okay. So you could also have total opacification. This all gets opacified with time. You can have bone erosions, you can have bone destruction, bone sclerosis. Bone sclerosis is thickening of the bone, and you see this in chronic sinusitis. If you keep on having maxillary sinusitis on and off, with time this bone gets sclerosed. We'll see how it looks like. You could also have calcifications inside the sinuses. These are seen in fungal infections. And you could also have sometimes fractures and foreign bodies inside. If you have a trauma case, sometimes you can also have foreign body going or displacing inside the sinuses.
Doctor, what does air fluid level mean?
Air fluid level means you have a level here in the sinus.
And so we can see
the above part is the air, the lower part is the fluid.
Okay.
So we call this air fluid level, a horizontal sort of fluid level like this.
No.
Okay.
Is there fluid in the left maxillary?
No, this is just some little bit of mucosal thickening on the other side. Okay, there is no fluid level here. The fluid level should be, because when you put the head like this, the fluid will be horizontal. If you make the patient lie, then it will sort of not have a level.
Yeah,
Here you see the patient lying, and again you see a fluid level. And there's another fluid level on the other side. So this is acute sinusitis, bilateral acute maxillary sinusitis. In chronic sinusitis, you would not usually have fluid level, you would have mucosal thickening and this wall thickened. The wall would get sclerosed or thickened because on and off infection results in periostitis. Repeated infections inside would result in thickening of this maxillary wall. Again, fluid level here. So the reasons for can be acute sinusitis or blood or fracture if there is a trauma history. Lavage. If the ENT surgeon has sort of cleaned the sinus, some part of the fluid can remain inside the sinus just after a lavage. So the history tells you whether there is a trauma history, whether there is lavage history, or whether it's just you found a fluid level incidentally. Obviously, acute sinusitis itself has its own clinical presentation. The patient would have pain, tenderness over the sinuses. He might be feverish, and WBC counts might be high. Yes.
So lavage is the name for surgery?
You sorry?
Lavage is.
It's a sort of surgery that it's a sort of cleaning procedure that the ENT surgeons do. They sort of clean the sinus. Okay, chronic maxillary sinusitis, I told you, on and off acute infections, they have their effect on the walls. So this is, compare this wall with this wall. This wall is thickened. So this means this sinus is opaque, you see, there's no fluid level, but the walls are also thick. So this means it's a completely blocked sort of sinus which has thickened walls. This tells you this is chronic sinusitis. This patient has had on and off sinusitis, maybe he takes antibiotics, it settles down, again he has the same problem. So the reason can be multiple reasons. Maybe it's the ostium that is blocked. He has the osteometrial disease. The sinus is unable to drain itself. Maybe there's something obstructing the ostium or drainage of the sinus. Then obviously do a CT and look for the cause. Why does he have the sinusitis again and again? Okay, clear on this? So can you differentiate between acute and chronic?
Yes.
In acute you would have fluid levels. In chronic you would have mucosal thickening and sclerosis, which is the wall thickening because of periostitis.
Doctor, we call that a complete opacity?
We call this a complete opacification. I mean the air has been replaced by an opacity, soft tissue opacity. Okay, so we talked about maxillary sinus. In the nasal cavity, there is another structure which is known as the nasal septum. You must have heard a lot of people have their nose deviating to one side. So it's the way of nature. Your nose, even my nose, is slightly deviated to one side. So when your nose develops, sometimes there is overgrowth of the nasal bone and the cartilage. So there is sometimes discrepancy on both sides. So one, you would have some part of the nose going deviated to one side. Most of the people have a deviated nasal septum. So the nasal septum goes to one side. So obviously they do a nasoplasty or septoplasty. That means the septum is sort of resected and they make it straight again. You could also have a spur formation, that is a bony projection from the nasal septum, which can also result in sort of obstruction or nasal occlusion. Now, this is a nasal septum which is slightly deviated to the other side, and this is a nasal septum with pneumatization, means there is air inside. So this is some variants of nasal septum. But a lot of ENT surgeons they have a lot of interest in the nasal area. They like to do turbinectomies, which is removal of the turbinates. Similarly, at the same time, they would also do septoplasty, repair the septum, make the nose straight again, so that the actors and it has a cosmetic value. A lot of people don't like their nose deviated on one side.
Really?
Yeah, really. What do you think? The females would love to have their nose on one side in the center. Okay. By the way, I have my nose deviated on one side. I don't mind it on one side. You might have your, I guess, a girlfriend or a wife objecting to it. I don't like your nose. Okay. There's another structure which is the turbinate. You see inferior turbinate and the middle turbinate. The middle turbinate at times gets pneumatized, means it has air inside. So when you have air inside the middle turbinate, it is known as concha bullosa. So we have this term which is known as concha bullosa. The problem with concha bullosa is there are two things that you should remember. Remember the ostium that I told you, the osteometrial complex, the drainage pathway of the maxillary sinus. If if you have the large concha bullosa, it can at times obstruct this ostium or the opening. So the ENT surgeon wants to